A serious reaction to dermal fillers after having GLP-1s was recently reported for the first time. Now, this is probably the scariest thing that can happen in a clinic, is to see someone have a serious allergic reaction. As a result, the clinician has announced that they will never treat a patient again who is on GLP-1s with dermal fillers, which I totally understand because of how scary that must have been. We do elective procedures, and clinician mental health really matters. If you're going to worry, don't do it. But this is why I won't be changing my position on treating patients with dermal fillers, even if they are on GLP-1s. To become very allergic to something, you have to first become sensitized to it, and sensitization is a very well understood process. First, you must be exposed to the new allergen, which might come in from your gut. You might breathe it in, it might come in through your skin. And interestingly, decreased gut bacteria is also associated with increased hypersensitivity. Antigens taken up by the immune system are then filtered according to whether your immune system thinks they either belong or don't belong. And the ones that don't belong are used to prime CD4 T cells to make antibodies. In short, T cells trigger a cascade that trigger B cells to make more antibodies, and also mast cells to prepare for the next response. They don't actually have a reaction until you are re-exposed to the same antigen. The most important part of this, and the reason why I will continue to treat patients who are on GLP-1s with hyaluronic acid, is the specificity of the molecules that require sensitization. Essentially, you don't become allergic to something because of another molecule. It is the molecule itself that triggers allergy, unless there is some crossover in the actual ingredients. This is a GLP-1 molecule on both sides, and essentially it's a protein, it's a peptide, so it is very different from a hyaluronic acid molecule. Molecules that are in a completely different class are unlikely to trigger allergic reactions, or we'd constantly be allergic to everything. But what if there was a drug that made you more likely to be allergic to everything? Now, maybe there is one, but it's not GLP-1s. I've researched this. I cannot find any evidence of a global increase in allergic reactions or immune activity. So what do I think happened? Well, we are all exposed to trillions of allergens every day. So the chance that it is the one that was injected versus one that came in through the gut, through the air, or through the skin is very low, considering all of the variables involved. And it's for this reason that I wouldn't draw the connection, but I do 100% respect that clinician's right to say that she doesn't want to do it if she doesn't feel comfortable, because, like I said, it's down to you to choose what feels risky or not, and doing less is never a problem. Everyone is safe when we take the cautious route, but I don't see a reason to connect these two events. I hope that helps.